Why do you want to go into private practice? I think they truly need to understand their why, because that's what's going to keep them going. If they want more autonomy, if they want, more flexibility on how they treat patients and in their hours, and are they willing to manage staff at least until you get big enough to have an office manager, then I think a private practice is a good fit for them. So the first thing they need to do would be to create a business plan. And I have a great business plan template that I give to all my new physicians that I work with. And it makes it so much easier to have a plan in place, right? And it's a step-by-step template of like, what is your mission statement, right? And it gives an example and then you put yours in. Your business plan, what you look at is kind of like a roadmap to secure funding. Your bankers are going to ask for a business plan. And so you need to have one in place, and that's how they'll look at giving you money. But your business plan helps you secure funding. It helps you outline your goals, and you're going to figure out who your target market is, what services you offer, a pricing strategy, and your financial projections of probably 1 to 5 years. That all needs to go into your business plan, right? Many doctors who want to go into private practice don't have the time or the expertise to building a plan like this. And so that's why this template's super valuable and helpful to them in doing that. So first thing, again, create a business plan. Everybody's going to ask for it. The second thing that you're going to do is your legal structure. You need to figure out how you want to set up your company. So by that is, do you need a PLLC? Do you want an LLC, an S Corp? So you're going to look at figuring all that out. And if you don't know what you need, I highly recommend talking to your lawyer about this to figure out what's best for your situation. And another thing that we actually do is we have a vetted network, so that if they don't have a lawyer to ask these questions, that's something either we can help do and do it for them, or we can, send them to somebody that we trust. The next thing is going to be location. Location, right? Everybody says location's key. And it is. It's super important. You need to figure out things like your proximity to public transportation if you're targeting people who are more your Medicaid patients or who don't drive. Are you needing a hospital? How close do you need to be to a hospital if you're taking call? You need to look at parking availability, the overall environment of the place. Like, is it safe? Patients don't want to go someplace if it's not safe and it's not clean. And I actually did a really, really good video on this exact topic. And there is a short clip of it that's actually on my YouTube channel. It's like, what do patients look for in a medical practice? So it's free and it's on my YouTube channel, but it just talks about other things that patients are looking for, and it's super helpful. But I do think it's important to choose a strategic location that's good for your patients. And the other important thing about location is you can't start getting credentialed until you have a location. So you've got to find a great place. And a little tip that I like to tell my doctors is look for a healthcare realtor. Use a healthcare realtor. Typically, they're realtors who only work in the healthcare arena. And so they know exactly what to help you look for. They will help you negotiate your contracts with the leasing contracts, things like that. So they're really, really helpful. And you as the physician won't pay them. It's going to be the company who you lease from that actually pays. So there's a little tip. The fourth thing I would say to starting your practice is going to be then you get licensing and credentialing going. So once you get your location, then you're allowed to start insurance contracts. That typically will take 6 months. So it takes a while. That's why it's important to kind of get these things in place. But you need to look at ensuring you have all the correct licenses and practice legally in your area, such as state licenses, professional licensing certifications, maybe a membership relevant to your professional organizations, all these things. So those were the first 4 steps into getting your practice started.
The fix isn't more automation. It's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human to human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about their healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, put the link below, check it out, and give us a call if it makes sense.